When a therapist visits you for the first time, they will instruct you on some basic safety precautions after your hip or knee surgery. It is important to keep your shoulders, hips, and knees in alignment and to avoid twisting. To get out of bed this way, do a partial sit-up, straight up with your arms to support you, hands beside your hips. From this position, shift your body weight as you move your legs to the edge of the bed. Remember to avoid twisting at your hips while keeping your legs about shoulder width apart. To transfer from a sitting to standing position, extend the operated leg and push straight down with your hands on the bed as you stand without bending forward. Once you are nearly upright, reach for the walker one hand at a time. It is very important that you do not pull yourself from the walker. Your therapist will instruct you in the amount of weight that you can bear on your operated leg. To begin walking with a walker, advance the walker forward about arm's length. Take a step to the middle of the walker with your operated leg, then push through your arms and take a step with the unoperated leg, all while remembering to maintain weight-bearing restrictions. You will repeat this sequence until you arrive at your destination, in this case, a chair. Approach the chair, staying as close as possible to allow for turning safely with the walker. Step around rather than pivoting on the operated leg. You will step backwards until you feel the chair touch the back of your legs. Step forward with the operated leg and reach back for the arms of the chair, one hand at a time. Lower yourself slowly into the chair, remembering not to bend forward. To transfer from a sitting to standing position from a chair, begin by scooting your way to the edge of the chair. Extend the operated leg and push straight down with your hands on the arms of the chair as you stand without bending forward. Once you are nearly upright, reach for the walker one hand at a time. Following your walking sequence, approach the bed and turn in the same manner as previously instructed. Once you feel the bed touch the back of your legs, step forward with the operated leg and reach back for the mattress. Use your arms to slowly lower yourself to a seated position. Scoot straight back until both knees are supported on the bed. With your hands on the bed next to your hips, use the strength of your arms to repeatedly shift your hips a little at a time until you are repositioned in bed. You may need some special equipment for your bathroom. An extra wide tub seat or shower chair is recommended. Sitting while showering is much safer than standing, and you don't even need to step into the tub before you sit down. Position yourself so the back of your legs touch the bathtub. Step forward with your operated leg and reach with one hand to the back of the seat. Then reach for the base of the seat with your other hand. Slowly lower yourself to a sitting position. Scoot back on the wide seat, lifting your legs one at a time into the tub without twisting. A handheld shower hose and long-handled bath sponge can be used when you are sitting to bathe. A long-handled bath sponge makes washing, even drying your feet, possible without bending. When you are stronger and steadier on your feet, you may be able to stand to shower, but you should have a non-slip surface on the floor of the tub or shower. To get out of the tub, simply reverse the process of getting in. With your operated leg extended, swing your legs out over the tub edge. Without twisting, scoot to the edge of the seat. Hold on to the back of the tub seat with one hand and the base of the seat with the other and push to stand straight up. A grab bar can be mounted on the side of the tub or wall for additional safety. Grab bars assist you with transfers and balance while standing. A Versamode can function as a high commode seat, a bedside commode, or a seat inside a walk-in shower. Any higher than normal surface is easier to rise from and essential to help you adhere to your hip precautions. Transferring onto and off of a Versa mode is the same as a chair transfer. You will need to follow your precautions when you get into the car. Have your driver move the seat back as far as possible in a semi-reclined position. The driver will place a plastic bag on the front passenger seat of the car. You will back up to the seat until your legs touch the seat edge. Step forward with your operated leg. Reach back for the dash with your left hand and the back of the seat with your right hand. Sit down gently. Move straight back toward the driver's seat using the strength of your arms. Without twisting at the waist or bending forward, move your legs into the car. Remember not to raise your operated knee higher than your hip joint. To get out of the car, move your legs out the door using your arms and unoperated leg to help you pivot without twisting at the waist or bending forward. Scoot to the edge of the seat by holding onto the dash and the back of the seat. Extend the operated leg, push down on your hands and stand straight up without bending forward. Make sure the walker is set outside the car for you. If getting into the front seat of a car is too difficult, you may need to ride in the back seat at first. Your therapist will instruct you if necessary.